There's probably been no bigger political football than the Affordable Care Act or Obamacare. And let's face it, the rollout was a disaster. I do think at times, though, we need to look at it from some historical perspective. Everybody loves Medicare today. People forgot that when Medicare was passed 49 years ago, Congress didn't fully get it right with that important piece of legislation. They had to come back and fix it. What I hear from Virginians is they don't want to go back to the days when people with pre-existing conditions couldn't get health care, or when women were charged more than men, or when parents couldn't keep their kids on their health care plan until they're 26. But let's face it, there's a lot that needs to be changed with the Affordable Care Act. So let me give you 4 suggestions that I've been working on, where I've got specific legislation. First, there needs to be a cheaper option. If we're going to attract more people into the system, I think a cheaper option makes sense. I've got a plan that would create a copper plan that would be at a 50% actuarial value. Second, I have got legislation that would cut back on some of the burdensome reporting requirements. I think it was one of the reasons why the National Retail Federation named me one of their legislators of the year, because they've been very supportive of this idea of cutting back on some of the reporting requirements. Third is, on the employer mandate, I think we ought to delay it to see how this bill is implemented and see if it is fixed. And if not delay, at least raise the mandate from 50 employees to 100 employees, which would mean that about 96-97% of Virginia businesses wouldn't be covered by the mandate. And finally, we need to also look at how we can increase competition. So I've got legislation that would actually allow insurance companies, as long as there were appropriate consumer protections, to be able to sell products across state line. The more competition, the better. These are 4 specific ideas that I've got. If there are other good ideas, I'm welcome to those as well. But we've got to start. What we've got to get away from, though, is this kind of approach that says we're not going to change a word of it, or we're going to go out and do these meaningless 50-time repeal political posturing votes. It all comes back again to, from health care to financial regulatory reform, where we need to make improvements and changes as well. You've got to have people in Congress that can work together.